PHA 567B, Determinants of Health. In the previous lecture, we have discussed the indicators of the public health situation in a country. Today, we're going to talk about determinants of health. The idea is, if you think about indicators as measures that gauge the general health situation in a certain population, um, the determinants are, on the other hand, the things that influences the general health of the general population. In other terms, you can think about the indicators as the outcome, whereas the determinants of health are the inputs in the system. So today, as I said, we're going to talk about the determinants of health. Um, Determinants of health could be discussed at four levels as the inputs or the indicators were discussed at four levels. هنحكي عن the determinants of health at four levels. We have the individual level, we have the community level, we have the national level, and we have the global environmental level. All right, so but before we do that, just a quick note that the Declaration of Alma-Ata in 1978, which we have already mentioned previously, the WHO, members in the WHO identified priority areas to address the health needs and the fundamental indicators. The declaration went beyond the primary care. So let's go back to the determinants of health. The first level of the determinants of health is the individual level, the personal level. And here we have five areas. We have the physical, the socio-economical, educational attainment, psychological factors, and behavioral factors. We're going to give examples of each one of these sublevels. So for the physical level, we're talking about both what is inherited and what is acquired. So something like your genetic predisposition of somebody to develop breast cancer. This is a physical individual level. Somebody's immunity, whether it's inherited or acquired through vaccination, it's also the individual physical level. Somebody's physical fitness, how much body fat they have, the level of activity, their BMI, they can work on that, they can ameliorate it, they can do it better, of course, but still it's under the physical individual level. The second individual level recognized here is the socioeconomic. And here I'm pointing out to something that WHO pointed, is that WHO recognizes poverty as the single greatest killer. The single greatest killer is poverty. Lack of economic resources may lead to inadequate nutrition, and that will lead to more and more problems. So this is still at the socioeconomic level, at the individual level. Okay, a person does not have enough income, that will lead to a lot of problems, ultimately leading in bad health. Maybe, like, you may or may not have heard recently the studies that look at if people are willing to sacrifice their medication in terms of the socioeconomic crisis we're living in currently. They might not buy all the medications that they're supposed to buy, sacrifice some of it for other reasons. So that is because of their socioeconomical status. We're still with the individual level. We're talking now about number 3, which is educational attainment. Um, Something that has been over and over and over shown is that maternal education, a mother with a better education, has a strong association with the child's health. مشان هيك في كتير work on educating mothers. Another thing is increased education is associated with the better health behavior. كمان in any kind of study looking at health, if you were to measure the education of either the person, if they're an adult, or their parents, if they're young adults or children, parents, whether the mother or the father or both, you will find a strong association between the health condition of the entire family and the education of the father and the mother. In fact, education of the father and the mother has been used as a proxy to measuring the socioeconomic status of families. There's a study that was done in AUB back in the 80s, and they found out that if you want to measure the socioeconomic status, the simplest way is to look at the educational level of the father and mother. Still at the individual level, the psychological factor, and here we have an example: stress. If you're living in a stressful environment, that will cause you to have more detrimental health outcomes. Stress is always associated whether with cardiovascular disease or any kind of disease. It's well known, studied element. Number five, and the last one, is the behavioral factor, which might be the most the thing that you would think of the fastest when you're talking about individual level, like how people behave, specifically smoking, exercising, eating healthy, and whether they are involved in activities that are high risk taking activities. If you think about these four elements, maybe the first three, the smoking, the exercise, and how healthy people eat, uh, there has been a tremendous work done on that, and it has been shown that these are maybe the most important elements at the individual level um, for 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 health that you can change. Okay, I said previously that poverty is the single greatest killer because it's not easy to change poverty. You need programs at the level of the governments, etc. But at the level of the individual, uh, in principle, smoking, they could quit smoke, exercising, they can engage in any type of exercise, even at their own house. They can change the way they eat, and that will have a tremendous impact on their health. So enough with the individual level. Now we're going to go to a wider circle, which is the community. So community could be a school level, it could be a village, it could be a city, uh, any kind of community. And here we have 9 areas. So economic, food supplies, water and sanitation, housing, physical environment, social environment, education and social services, local government, and primary care. So what is important here is that you remember that we're no longer looking at individuals themselves, rather we're looking at the community itself and what the community can provide as service, or maybe the lack of service that would impact your health. So like for instance, if I were to ask you, like, think about something that within your environment that impact your health, the first thing that comes to your mind might be, I'm hoping, is pollution. Maybe you could be living next to an electric generator that is not equipped with filters. Um, okay, so that could be an example. This is your community. That's not it's not you. It's the community where you live. Okay, so let's look at them. And again, we're giving examples. So economic, employment and income. If you're living in an area where there is a high demand for employment, so you can actually get a job, you can actually work instead of being unemployed, and then for if you have an income, you probably can purchase health insurance, etc., etc. Here, I'm gonna just give an example a little bit with the U.S. that is a bit different from here. In the US, it's very important for someone to have a health insurance to be able to have access to proper care. Otherwise, they might not be able to access proper health care. And this is where I mentioned in class the the Obamacare. Uh, the appropriate name is it will come back to me, where the Obama tried to provide an alternative solution for those that cannot purchase insurance by themselves. Uh, Affordable care, this is the word I'm looking for, the affordable care, so that they could actually afford to purchase an insurance and be able to receive the healthcare services that they need, which is a bit different from the situation where we are, because you might know that where we are, you may be able to get healthcare through Wizard al-Saha, NSSF, or like any other places. So here I'm just drawing a difference between the US and Lebanon. Number two is the food supplies. Um, Availability of food or food of good nutritional value is important. You may be thinking of if we want to draw, if we want to make the community as small as maybe a university. At the university level, can you get food of good quality? Or is it that if you want to go buy food, it's only going to be fast food filled with fats that is not very nutritious, very high calorie, and things like that? In the US, again, I'm trying to give you an idea of in the US for a very long. So I was saying in the US for a very long time, the cheapest food would be the fast food chains, where you can go in and buy for a couple of dollars a large burger with large fries and Pepsi or any soft drinks. And with only maybe an additional dollar, you can supersize your Pepsi, you can supersize your fries. So there was a lot of um, I don't know the word, but let's say pressure, if that's the word I'm looking for, to make you eat unhealthy because it's cheap and because you would be thinking, well, I'll be only paying half a dollar or dollar and I will be supersizing my fries, etc. Which, on contrary, in Lebanon, in the country in Lebanon, food-wise, our foods, it's the Mediterranean um, uh, diet, which if you read the literature, you will see there is a lot of literature on the Mediterranean diet. It's much, much healthier. So again, here there is a difference between us and the US. Although in the past few years there was a pressure on the fast food chains to provide an alternative food style for those that maybe like salads, etc. Another thing that is you should be thinking of is in the US, a lot of families that are not well doing, they send their children to school, and they get stipend or they get support where their children actually eat at school. So the main dish or the main food dish is through the school. So again, what is the schools providing as the main dish for these children? Is it a good quality food studied by dietitian, etc., or is it just again fast food? And which takes us also for if you think about breakfast, like the typical breakfast of the Lebanese versus the American. The typical breakfast يمكن نحن عنا is لبنة وجبنة وزعتر etc. Whereas in the US it could be cornflakes, where the majority of the cornflakes is very rich with sugar. Okay, so moving along to the third one is water and sanitation. Um, um, if the water system is not built properly, and if the water gets contaminated, then you will definitely see epidemics of cholera, diarrhea, hepatitis, etc. If the wastewater is contaminating the water, you will see come in diarrhea and hookworm disease. Is our garbage is not well disposed, you'll see rats, vector-borne diseases, mosquitoes, which I think we have suffered from these in the past years in Lebanon, and we have seen what happened when there's no proper disposal of garbage and the garbage is left in the streets. The kind of I'm not going to say diseases because I don't know if there has been studies showing that there is this diseases, but obviously we started seeing new types of mosquitoes and flies, which we did not used to see previously. Um, so I think in the class I spoke of, you can think here for the refugees camp, for example, as a community level. إذا عنا big refugees camp, is the water and the wastewater system built appropriately? في crossing between the water and the wastewater. I think from the standpoint of building these things, they try as much as possible not to cross the water and the wastewater in a single point. يعني عم يحفروا عم يمدوا المي وعم يمدوا المجارير. As much as possible, these two lines should not cross at any point in time, because if they cross, the risk of contamination is high. وطبعا إذا صار في contamination, then you start seeing vector-borne illnesses. We're still at the community level. Now at number four is housing. Here you have to think about the type of housing that we have maybe in Lebanon versus outside Lebanon. نحن in Lebanon, it's most of the houses are built with concrete, which makes it easier um, for an infestation not to occur. Whereas if you're thinking about the typical house in the US, which is built out of wood, mice and rats, they can start living between the walls, they can infest the walls, and they can propagate illnesses. Another example, which I also mentioned in class, is for the living stocks. So at one point in time, there was the outbreak of the swine flu, and that, according to studies, started because of somewhere in China, people were living with their pigs in the same house. Pig farmers, I think, in certain areas in China, they live with their pigs, and therefore the virus jumped from pigs to human. Number five is the physical environment, the pollution, right? As I mentioned previously, do you live near um, uh, motor kahraba where there's a lot of fumes going out, and if you have asthma, it might affect your asthma. Do you have facilities to exercise? Do you have place that you can go and walk? Are these available? Do you have a sidewalk if you want to walk on the streets? Do we have sidewalks? In Lebanon, it might not be an issue because we do have sidewalks everywhere, but believe me, in the US, you may have entire places where there's no sidewalks. Roads and traffic control, they will definitely reduce the risk of injuries. We're still at the community level, the social environment, equity in resource allocation, and here you have this drawing that showing the difference between equality and equity. So equity is providing communities with the resources they need, not dividing the resources equally. Rather that every community gets what it needs. So one community might get more than the other because it needs more. Culture that supports healthy lifestyle. This is also an example that I gave during lecture, which we talked about smoking indoor and how we have changed over maybe the 30, 40 years, where smoking used to be very acceptable indoor, even if there is a very elderly person that is sick or a child or a newborn. Whereas now, thankfully, there has been a lot of change in how we perceive smoking in the community, and more we are more accepting the idea of asking people not to smoke indoor, but rather to step outside to smoke. Also, you can think about universities that have adopted smoke-free environment. LAU over the past 10 years went from being smoking everywhere to allocated spaces, and you can no longer smoke inside the building till we reach now where we are currently. Number seven, under communication on the community level, is education and social services. So here we're talking about not the individual education of the person, but the availability of schools. So again, you can think about the refugees, Syrian refugees in Lebanon, and how much there is availability for schooling for these children. I know the schools, the national schools, uh, كانوا عاملين دوامين, one in the morning and one in the afternoon. The morning is for the Lebanese children, in the afternoon it was for the Syrian children. Social services for the handicapped, how much do we provide that? Do we provide access to the handicapped? Do we have, if you want to, is the community, the village, the city equipped so that a handicapped can access uh, roads, walking sideways, getting into the mall, getting off the mall, etc. We're still at the community level, the local government. So the local government could be your municipality, etc. So readiness to disaster response, how much fee residence to the disaster. You can think about the Beirut bombing that happened last year, and how much our government, or you can think of this at the national level, but you can also think at the local level. Uh, the Beirut municipality, how much ready was it for something like this? And A disaster doesn't have to be a man-made disaster. It could be a natural disaster, a flooding, an earthquake, a volcano, a hurricane, a tornado, anything of the sorts. How much the community is ready to respond? Do we have an allocated area for people to go to? Is there enough food and water supplied if people need to be staying in shelters for a certain period of time? And things like that. Does your local government, مثلا in the States, there are areas معروفين اسمهم tornado corridor. Oklahoma is one of them. I remember I lived there. So there is a specific period of time in the year where you will have a lot of tornadoes. And as I mentioned, they live in wood house made out of wood. And a tornado will just destroy houses like that. If you have a concrete house like the ones we have in Lebanon, a tornado won't do anything to that house. But houses built out of wood, it would totally destroy it. So some people will have like a closet in their house that is made out of concrete. So in case there is a tornado, they can hide inside of it. A cellar, like small cellar underground that they can go and hide. So the question is, does the local community or local county, does it have like specific laws for you to make you build something like this? Does it facilitate it? Does it give you a support? And number nine, finally, is the at the community level is the primary care availability of primary care to prevent further deterioration in health and timely medical intervention. I mentioned this in class again. The primary care in Lebanon is delivered by something called the primary care centers اللي هن المستوصفات. Even though sometimes they step beyond their boundary by providing medication, which they shouldn't. If you listen to the OPL, the Lebanese Pharmacy Organization, uh, but there is a lot of services provided by these primary care centers, Mustawsafet, and I mentioned previously that we have like 700 or 800 primary healthcare services centers all over the country, and they do provide a lot of services to the Lebanese, to the Syrian, to the Palestinian, and they're supported by NGOs or some of them by the government, some of them by political parties, religious groups, etc. Which is not the case in the US. In the US, they do not have this concept of primary care centers. All right, so we finished with community level. Let's move to national level. At the national level, we have four areas. We have the communication networks, government, public health systems, and health insurance, health services. Communication networks is the availability of highways for transportation of food and supplies and emergency travel for injured person. Maybe that is not a big issue for a small country like ours, where you can actually go from one area to another area fairly simply, unless our highway deteriorates even more to a point where it becomes very hard to move from place to place. But if you think about a country like the US, which is almost a continent, um, the uh, the 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 availability of highways is very important to be able to move from one place to another place. mentioning كمان they do use helicopters, especially لما بيصير في big accidents, to be able to get and extract the injured person and take them to the hospital. Even if you go beyond the US, if you go to countries, I think something like Australia, which again is a huge country, almost a continent, there's a lot of villages that are just detached from cities, and it's just dirt road to get to them. Um, Number two, under national level, is the government, competent health officials that can identify health needs and work on them. So our representative in the government, people that have enough education, enough competence to be able to um, make services available. And I mentioned this in class. لما صار في انفجار the diesel uh, truck that exploded. Most of the injuries were due they were suffering from burns. And what is sad is that we have a hospital that was built and equipped and fully done by, I think it's the Turkish government, and it was just gifted to Lebanon. I think it's in Saida, and it hasn't been sitting there for I don't know how many years, never to be used. This is because of our government representatives, which they are incompetent or worse, faced in, and they're fighting against who gets to get what, etc. Kamel government is their capacity of passing rules and laws that can support the health of communities. We're still at the national level, the public health system, surveillance for outbreaks and quick response. In case there is an outbreak, how fast are we to catch this outbreak and to be able maybe to stop it, to put it under control? Collection of data for health indicators, how well is the quality of data that we're collecting so that we can calculate the health indicators that we spoke about in the previous lectures, so that we have a good idea of where we are to be able to improve ourselves. Number four, at the national level, is health insurance and health system. Disadvantaged groups being able to have access to high quality healthcare services. I think I mentioned that a little bit when I was talking about the health insurance, and we may have to talk about it later on when we talk about the health service system in the US. Who provides the health service system? And for those that do not have insurance, how can they get the service in the US versus in Lebanon? And how easy is it to get the service if you cannot afford it? At the global level, we have two areas that are outlined. The public health organizations, for example, the WHO, um, that allows multiple countries to address a common health issue, a global threat. Here we have HIV and the Merck, but obviously we can add to it now Corona, COVID-19, and how much the WHO is supporting. And you know that the vaccination through the system is through WHO. WHO made sure that countries that cannot afford to buy the vaccination, uh, they can get access to vaccination through that system. I forgot the name for that system, but you can look it up. Um, Two is violence. If you're living in an area where there's war or a terror attack or there was immigration issues, um, that would put you at a place where uh, your health might be at risk. And I finished this chapter with the question about what could be the role of the health of the pharmacist so that they can support or provide or influence or change the health determinants. So that concludes this lecture.